là Vũ Ngọc Ánh. Thì hôm nay thì Ánh có mặt tại bệnh viện Answer.
Meet Vietnamese celebrity Annie. She contacted Seoul Guide Medical because she wanted to have revision rhinoplasty in Korea. She originally had rhinoplasty done in Vietnam but was unsatisfied with the results. She felt her bridge implant did not add enough height. Her tip was done incorrectly, her alars are still too wide, and there was a deviation in her septum that was not corrected. In addition, she asked for fat grafting to be done to the mouth lines. Annie chose Dr. Choi at answerplasticsurgery after a detailed online consultation with Seoul Guide Medical staff, as he is an expert in rhinoplasty and revision rhinoplasty. Annie's case was very difficult, as the original rhinoplasty was not done correctly in her home country. An ear cartilage was removed from both ears, meaning that there was no ear cartilage left to use. Normally, if ear cartilage is removed, then it is done from only a single ear. We don't know why the previous surgeon removed it from both ears. Dr. Choi can use ear cartilage for the tip of the nose to create a natural look, but if there is not enough left in the ears, it has to be taken from the ribs. This requires a small 3 cm long incision to be made on one of the ribs. There will be slight scarring, but it is not too bad. Many people ask us if it is better to use rib cartilage for the tip. The answer is no. An expert can use ear cartilage to create a beautiful looking tip without the need of rib cartilage in most cases. This applies to revision cases as well, as long as there is still some left in the ears. We also have patients ask us about using rib cartilage on the bridge of the nose instead of an implant, if more height is needed. Many doctors use this technique to create a natural looking bridge. However, we have to say that in our experience, this is not a good idea in general. There is a lot of warping and absorption which happens when using rib cartilage on the bridge. The result may be initially pleasing, but if warping or absorption occurs, then the nose bridge will be unbalanced. In general, implants tend to be better if placed correctly and in the proper pocket of the nose. They can also look very natural, as long as you don't go overboard with the height. Although it is always on a case-by-case basis, from our experience, and from what most doctors recommend here, an implant will serve you better than rib cartilage for the nose bridge. Annie asked about having alarplasty, which reduces the width of the alars on the sides of the nose. The alars come in a bit when doing tipplasty, which raises the tip. The alars can also be tucked in more if needed, but there are limits. If you go too far, then you will have issues breathing, or it can look extremely unnatural. If you want a natural look while still improving on the original, then follow the doctor's recommended alar position advice and don't go past that. In most cases, the natural look, which is more balanced, is more pleasing, but then again, everything is on a case-by-case basis. Annie decided to have them reduced a bit while still maintaining the natural look. The drawings you see on Annie's face are where the fat grafting will be placed. Fat will be taken from the back of the thigh, processed and injected into the mouth lines to produce a younger, fresher look. Annie was worried about having a pig nose, a nose tip which is too high. At this point, we explained again about the doctor's advice and the angles which suit her face best. If you have last-minute questions, we are here to answer them for you. We will be with you every step of the way. This is Annie the next day after surgery. She had to come back for a checkup, cleaning, and antibiotic shot. Seoul Guide Medical is also with you during your post-visit checks. Here is Annie on day 3 for another checkup and cleaning. At this point, your nose will be very swollen and not like the final product. Make sure you understand this and have a proper set of expectations. Full setting can take anywhere from 6 to 12 months. Here are some of Annie's complaints about the results of her first surgery in Vietnam. Revision is always more difficult and expensive than a first-time surgery. You are much better off getting it done by an expert the first time. Annie recently sent in her 4-month update photos. She is extremely happy with the results and is back to doing TV, movies, and more in Vietnam. Her mouth lines are much improved and her nose is as she wants, balanced and beautiful.
Don't forget to visit our site at answerplasticsurgery.com, where you can find a comprehensive list on all the procedures we offer. Leave us a big thumbs up and any questions below. And as always, thanks for watching.